Māori oho, Māori tū, Māori ora, kia tātou, haumi e, hui e, tāhiki e. Kia ora and welcome to the third in the Ask the Experts online series. This series of 3 online events has been organised by the Island Bay Enhancement Trust, who was set up to enhance the beauty of Island Bay and the well-being of the land and people, to enhance the cultural, artistic and social life of Island Bay. The annual Island Bay Enhancement Trust is most well known for organising the annual Island Bay Festival, and this series of online events is to support the well-being of our community, considering the cancellation of this year's festival. The previous 2 online events were recorded and can be found on the Island Bay Enhancement Trust YouTube channel. And tonight's event is being recorded, so if you are joining us live, you can rewatch it if you want to, or share it with your friends. And a shout out to anyone who is watching the recording. No mai, haere mai. My name is Tai, and I work for Adult and Community Education, Aotearoa. And I've been asked back to facilitate tonight's kōrero. And our topic tonight is Omicron. You can tell me how to say that properly later. Masks and more.
I'll try again.
Tonight we are joined again by Dr Marion Leighton. Marion is a specialist physician at Wellington Hospital, Mary Potter Hospice. She is a strong community advocate and has helped coordinate joint health and housing COVID responses throughout this pandemic. She's also a senior lecturer at the University of Otago and the lead physician for Doctors for Active Safe Transport. Welcome back, Marion. How are you this evening?
Thank you, very well. Nice to be here, and good to have you facilitating again, Tai. I believe we've had a whole heap of questions sent in.
We have had quite a few questions sent in, so we're going to try to get through as many as we can. So let's start with our first question. I'm not saying that any of these are going to be easy, because I don't know any of the answers to these, so I'm looking forward to hearing. If I get COVID once, can I get it again?
Yes, you can. So COVID is like many of our cold viruses. The difference between COVID and a standard cold virus is twofold. One is none of us had ever seen this virus before, and the other is this particular type of cold virus makes our immune systems go into overdrive, and that's one of the ways we get so sick with it, which is why it's been a big deal for the last 2 years. But the reality is, with all of these types of viruses, our immunity wanes after we get an infection, and so you can get it again, just like you can get a cold again. We don't know exactly how many exposures you need before you start to build up enough immunity to only get really mild symptoms. Probably somewhere between 4 and 6. So that's why kids get way more colds than adults do. We've just seen them all by the time as we get older and older. And so it looks like we don't get as many colds, but actually it's because our immune system has developed immunity to them. Now you can develop this immunity by catching the colds or by getting vaccinated. So you can do it either way, but it's gonna take more than 1 or 2 exposures for you to get it. Initially, we didn't know how common it was with Delta. About 5% who'd had COVID before were getting Delta infections, and they were getting them really severely second time round. So it wasn't giving them any immunity at all. With Omicron, it seems to be more common that you get another infection, but it does seem to be less nasty if you get it the second time around, because it's more similar to the original virus that came out of Wuhan and the Alpha variant, which was the first variant we recognized.
Okay. Okay, so let's go to our next question. With under 5s now being only uniformly unvaccinated, being the only uniformly unvaccinated group in society that we live in, where possible, how do we go about shielding them from, how do we shield them from the vaccine because they're not vaccinated?
Shield them from the virus.
From the virus, sorry.
Shield them from the virus, yeah. To tell you the truth, so children and COVID it's a tricky thing to get your head around, because the reason we have vaccinated children late is because their immune systems are way, way better than ours are. And so as a result, they don't tend to get such severe illness with COVID than older folks who've got often already got underlying conditions such as hypertension or a bit of diabetes or stuff like that makes us have a worse response to this illness. And so overall, children actually don't get severe illness. The problem is that some of them will. So it's this weird tension between we really want kids to live their full lives as much as possible. We know keeping them out of school and early childhood centres and things like that isn't good for their well-being. But we also do want to protect them. The few who might get sick from it, we want to protect them from being sick. And that's where as many adults and older children in the household being vaccinated as possible will make quite a big difference to whether kids catch COVID or not. So making sure all the over 5s are vaccinated and all the over 18s have had their booster that they're going to come into contact with, and early childhood centres and places like that they're going to during the day. Those people are taking a lot of care about making sure there's good hand hygiene and distancing and a lot of different care to the way they normally would. We also ask that you keep your kids that are under 5 who have symptoms of a virus, a runny nose, a sniffle, a sore throat, keep them at home. You probably want to go and get them tested. We do the tests aren't as bad for children. We can get the virus from in other ways than doing the nasty nasal swab. But get them tested and keep them home until those symptoms are definitely improving. And then you're less likely to spread cold symptoms around the early childhood centre and to other kids who might pick things up.
Okay, cool. So here's one about breast milk. So I know breast milk from a vaccinated mother will offer some immunity to our tamariki. Is there any updated information about the amount or the consistency of the milk feeds to offer that protection to our tamariki?
Yeah, no, breast milk is really, really good for kids, and particularly in that first 3 months. So certainly if you are breastfeeding a child and you've had the vaccine, it will give the baby that little bit of extra protection in terms of antibodies. But the bottom line, there's no difference in feeding. You just feed the child as you normally would, use breast milk as you normally would. And bear in mind as well that some people can't breastfeed for lots of reasons. So the child won't, the mother can't, whatever reason, and a fed baby is much more important than necessarily having the breast milk. So yeah, it's good, but if you can't do it, don't panic. It's okay. Feed your baby the way you normally would.
Awesome. Okay, here we go. Will I definitely get COVID?
The answer to that, interestingly, is not necessarily. There are, and believe it or not, plenty of people overseas who have not got COVID, even with it having ripped through countries. Well, I say, will I definitely get it? You probably will get it eventually, but you might not get it in this wave. So what we found is, particularly if you're vaccinated and boosted, your chance of getting COVID off a household member who's positive is about 1 in 4. So actually 3 in 4 of you won't get it, especially if you keep the extra precautions that we recommend when you're living with someone and you're isolating together. Wear a mask if you're up close to a positive person, don't share towels or the bathroom, keep ventilation up, all of that. You can actually, there's a reasonable chance that you won't catch it if you're also vaccinated and boosted. So the answer is no, not necessarily this time round. Maybe, as it goes through the population and as we, once it becomes, most people have had it or we've been able to have a couple more booster doses, it won't be as serious, and then it'll be floating around a lot more like a cold than like the serious illness it still is at the moment.
Okay. It would be good to understand the average Omicron timeline. So the example here is my boss is feeling sick, has had a COVID test and is waiting on the results. I worked with them in the office on Thursday. Is it likely I've been exposed if they have it, or is it too fast to shed the virus? Can you please talk about the virus timeline?
Okay, so the virus, Omicron's got a much shorter incubation period than some of the other coronaviruses did, or variants did. It can still take 10 days to show up, and every now and then even a little bit longer, but mostly it's showing up within 3 to 5 days in people. But we do know that you can shed virus for a day, maybe 2 days before you start getting symptoms. So if you were in the office on Friday, if your boss got sick on Friday and you were in the office with them on Thursday, then yes, they could have been shedding virus at that point in time. If you were wearing masks and you were keeping 1 meter away from each other, or even 2 meters away from each other, and you had some windows open and some good ventilation, and you didn't spend lots of time rubbing your eyes and touching things, then there is a decent chance, like the household study, that you won't pick it up. With households, we're looking at 1 in 4, so about 25%. Probably in an office, it might be down around 10 to 20%. So it's not everyone that's going to catch it. The other thing is, right now, there's actually, although our rates are going up very steeply, actually only 5% of our tests in symptomatic people are showing that people have got COVID, are coming positive for COVID. So 95% of people who've got symptoms and are getting tested don't have COVID. They've got other colds and other things. So your boss is really likely to just have another cold. As we know, probably another 5% in the community have COVID and aren't getting tested, but that's still only 10%. So 90% of people probably don't have COVID. And the rates in Wellington are still lower than elsewhere in the country. The reality is that's going to change. The rates are going to go up, and the percentages are going to increase. So your boss's cold this week, your odds are pretty good. You probably won't get COVID from her, although you could. But by next week, the week after that, your risk is going to increase all the time. So if you do have symptoms, even if it's just a scratchy, niggly throat or a bit of a sniffle or some sneezing, it's best to work from home, call in sick, go and get tested, and stay home until those symptoms have resolved. Because then you're also not spreading your other colds and flus around the community, which means that we're not having this problem of do I or don't I? If people just aren't getting the colds, that's even better.
That's cool. You might not be able to answer this question, but there's a theory that because Wellington is so windy, that's why we have such low rates, because we have such great ventilation. But let's not answer that question. That's just a
I probably
rumor.
should. There are a couple of reasons why Wellington has low rates at the moment. And one probably is we really are well ventilated, and that's fantastic. But we are also really well vaccinated. Wellingtonians are up at 99% first dose of the eligible population. Like, we are fantastic at this. We're at 98% second dose. And our booster rates are also higher than most of the rest of the population. So well done, everyone. If you haven't had your booster yet, please go down and get it, and take all your friends down for it as well. But the reason, there's lots of reasons why we probably don't have it, and it's probably to do with we're taking it seriously. We're really good mask wearers. We're taking our workplaces seriously and a bit of distancing. We're not having big parties and spreader events, and we've chosen to get vaccinated, which is really fabulous.
Awesome. All right, so here's another question. I'm a bit hesitant to get my 8-year-old child vaccinated. I've heard the vaccine hasn't been tested enough on children. Can you talk a bit about this?
Yeah, so having just said, well done everyone for getting vaccinated, the people who haven't quite got the stats up are the 5 to 11-year-olds. So our rates in 5 to 11-year-olds are really lagging behind. Again, Wellington's done better than many other places in the country. I think we're a population that actually believe in the science and want to protect our kids using that method. But I can assure you that this vaccine has been really well tested on children. The COVID, this is where it gets tricky. So COVID is a dangerous disease in children, but not for most of them. So only 2% of 5 to 11-year-old children are going to get really sick with COVID. So 98% of them are going to be fine. But 2% there are 1 million children in New Zealand. 2% of 1 million is 20,000 children. That's a lot of children with severe disease. And some of those are going to be kids that are vulnerable, and some of them will be kids that are otherwise healthy. But while your kid might not be particularly vulnerable, they might be a strapping, healthy young thing, but they might be going to school with kids that are vulnerable. And so, getting them vaccinated is also about looking after everybody else. When they did the initial studies in the 5 to 11, so 1,500 children enrolled that got given the vaccine, and 700 that got the placebo. And that showed that at the lower dose that they're giving for the children's vaccine, they are it was safe and it was effective. Okay, so they didn't find any rare serious adverse events, and the lower dose sparked a really good immune response in kids. What they then did between the beginning of November and the middle of December is they actively followed up 42,000 children who'd had the vaccine. So they rang them all up, them or their parents, and they said, how are you feeling? What's going on? Have you needed to see the doctor, go to ED, whatever? So that 42,000 kids. So that was, they felt, a decent number for saying, are there any rare side effects that didn't come up in that first trial? And what they found was that kids make a really good immune response, which meant that a lot of them did get symptoms after the vaccine, like a sore arm, a mild fever, fatigue, headache, that sort of thing, but that there were no other super rare side effects. And since then, 9 million US children have had the vaccine up until Christmas. So that is, that's more children than the entire population of New Zealand. And what they found is the only signal for a serious adverse event is the myocarditis. And there have been 11 verified cases of myocarditis out of those 9 million children. So that's just about 1 in a million. So in New Zealand, we could expect to see out of our 1 million children, 1 case, maybe 2 or 3 if we were unlucky. And all of those 11 children with vaccine-induced myocarditis have made a full recovery with minimal treatment. So I think we can really safely say this vaccine has been well and robustly tested on young people all over the world, and is very safe.
Okay. So you mentioned myocarditis.
Mm-hmm.
So a question here, if I've had myocarditis before, am I more susceptible to getting it during a COVID infection?
Now, that's a really good question. Probably not. So you can get myocarditis for a number of reasons, although the commonest is any viral illness. So the common cold can cause myocarditis. I had myocarditis after a cold about 10 years ago. And, unfortunately, many of you may remember Rod Donald, who was one of our Green MPs a number of years ago. He very unfortunately died of a viral myocarditis unexpectedly. So viral myocarditis is common, but there doesn't seem to be a higher risk from getting it from one viral infection to getting it from another viral infection. And myocarditis that aren't related to viral infections don't get stimulated necessarily by viral infections. So your risk just goes back to essentially the baseline, same as everyone else in the population. So everyone's got very kind of, like, oh my goodness, myocarditis. But of course, most people have never heard of it before, whereas in hospital, we see it not all the time, but we know about it, we see it, we treat it. It's usually not dangerous, and we treat it very simply with non-steroidal drugs like ibuprofen, and it gets better on its own. We generally advise people not to do significant, intense exercise in the couple of weeks after a viral infection if they have had myocarditis. But yeah, that's the only other caveat. In terms of, no, if you've had it before, your risk of getting it with COVID infection is no higher than it probably was before, but the risk of getting myocarditis from COVID is quite high. We're seeing it in about 1 in 1,000 people in the previous variants. It seems to be less common with Omicron, but Israel has announced that they've had a couple of cases recently. So it's less common, but it's not unknown. And I remember Omicron's only been around for 12 weeks, if that. It only arrived in late November. And here we are in, February discussing, what do we know about this? It's amazing we know anything about it, really. So the myocarditis with the vaccine is also not really more common if you've had it before for other reasons, and it is way less common than getting myocarditis from COVID. So if you're worried about myocarditis, particularly if you're worried about the vaccine or about having a booster dose, the answer is almost certainly you should go ahead and have the vaccine, because the risk is about 1 in 25 to 50,000, depending on your age and gender, whereas with COVID, it's right up there at 1 in 1,000 people, and people do die of COVID myocarditis. It's a bit complicated as to why, but it's a dangerous thing to get.
Okay, cool. Not cool, but
not cool. Yeah,
your answer's cool. So I'm pregnant, not me personally, and I just don't think that they know enough about the vaccine's effects on pregnancy and the unborn child. They didn't test the vaccine on pregnant women, did they?
No, so we never test drugs on pregnant women. Never, ever, ever. In fact, normally when we do drug trials, we actually ask everyone who's in a drug trial, or we do two things actually. Often we only test drugs on men because they can't get pregnant, or we insist any women in a drug trial are either postmenopausal or on a really secure form of contraception. Interestingly, with this vaccine, Pfizer didn't make being on long-term contraception a requirement, and during the very initial trials 23 people did get pregnant, which is actually very, very unusual for a drug trial. Only one person had a problem and had a miscarriage, and she'd had the placebo. So the 22 people who'd had the actual vaccine, no problem seen at all, and that was through the initial trials. We also quickly became aware during that first year of COVID, before we had any vaccines, that COVID is a disaster in pregnancy. Pregnant people are more likely to get extremely sick. They're more likely to need ICU care and a thing called ECMO, which is like lung bypass treatment, where we have to rest your lungs by pumping your blood out into an artificial lung and back in again. It is really intense, and it's really not a good thing to have done. It also caused, the COVID in pregnancy did cause preterm birth and very occasionally stillbirth, and we've had pregnant women die, and to lose a young person who's pregnant is an absolute tragedy. So we were very keen in the healthcare industry to find a vaccine that could stop that. At one point in time in the middle of last year, pregnant women made up all the cases of unvaccinated pregnant women, made up all the cases in ICU on the lung bypass treatment in some UK hospitals. So while there aren't, in the bigger scheme of things, there aren't that many pregnant people kicking around at any one time, but my goodness, if you get COVID, it can be extremely dangerous. The vaccine's been shown to have no effect on early pregnancy, so there's no increased miscarriages, and also no effect on the baby, apart from that it can give the baby a boost in their own immunity. So in fact, from the baby's perspective, they come out with some immunity to COVID, which is excellent if you get any of your vaccine shots during pregnancy. We're now at the stage worldwide where over 200,000 pregnant people have had the vaccine, and they have all been as fine as anybody else. It's had no effects on the pregnancy and no deleterious effects on the babies either. So it's actually now become probably one of the most studied drugs we've ever used in pregnancy around the world. So you can have all your doses of vaccine during pregnancy if you need to, or you can have your, depending on where your pregnancy is at and this sort of thing. You might just get your booster in pregnancy. You might just have your first dose shortly before the end. While we're on the subject, it's also had no effect on fertility. Just as many people have managed to get pregnant and have babies during this, while the vaccine's been around. And it's also had no effect, no significant effect on the menstrual cycle. We've had a number of reports of people who have noticed that their periods have changed, either heavier bleeding or less heavy bleeding or abnormal timings of their periods. But in fact, when we've looked into it in a number of countries, it's been no different to the background rate of people having menstrual irregularities. So there doesn't seem to be any actual change in menstruation that goes beyond all the other stresses and things that we get up to in life.
Cool. Okay. So why don't under 18-year-olds get boosters?
Because under 18-year-olds are amazing, so they don't need boosters. Only us old people need boosters. It's because the vaccine dose and the vaccine schedule, the number of doses you need, is dependent upon the maturity of your immune system. So as you get older, your immune system doesn't make as good a response, and so you need more doses and more exposures and of a higher dose to get your immune system to get into action. So under 18s, what we found is them having 2 doses is as good as us older folks having 3 doses, that they're not getting the same waning of the immunity as we are. So 2 doses is their 3. And kiddies under 11s, the reason they have a lower dose vaccine is because their immune systems are so great that they didn't need the increased dose. And at the moment, there's certainly no evidence that they necessarily need a booster. The one thing I would say, though, is that we are wondering, and this is being wondered around the world, is whether 16 and 17-year-olds might benefit from a booster. And we're looking into that data at the moment. So it's a bit of a watch this space. We may well come out and say, actually, let's go for it for 16 and 17-year-olds. It may also be that what some people, even teenagers, have a higher risk of severe COVID. And so even though their immune systems are good, because of their higher risk, we might suggest that they, go ahead and get a booster. So maybe we'll say something like, if you're a strapping, healthy, no other problems in life person, you probably don't need a booster. But if you've got other medical problems, or even some, living in deprivation, or, in large multi-generational families where there's other people around that you might be thinking about protecting, then maybe, let's go ahead and have a booster. So it's more likely to be a bit more of a depends on your situation type call. And so at the moment it's watch this space. We're actively making decisions all over the world as to who'd benefit from a booster, and when, because maybe it's that they don't need one now, but they might need one in another 6 months or a year's time. And so we're just seeing, but the reason they don't now is because they don't need it, not because we're somehow withholding it from them.
All right, cool. So, does the vaccine permanently affect my DNA and therefore my future offspring's DNA?
No, because the vaccine doesn't affect your DNA at all. So therefore, it certainly can't affect your future offspring's DNA.
Right.
People have got, there's a number of reasons why people have got this idea in their head that in some ways it impacts on the DNA. One of them is because there have been some misinformation and disinformation stuff came out throughout this whole pandemic, because it's been a rife for people just making stuff up and spreading it for whatever reasons they want to, but that said that the virus had been found, or the vaccine particles rather, had been found in various places around the body. This was actually not true. And in fact was taken from studies for the COVID virus, which does indeed spread all through the body, not the vaccine, and extrapolated into, well, if we can find the virus in these places, then we must be able to find the vaccine in these places. So the answer is no. The other reason that people get mixed up is because RNA and DNA sound like the same thing, but they're not. So DNA lives inside the nucleus of our cells, which is the center of our cell. And basically that's like the library where all the coding, all the books that say, this is where all the information is to make you the person you are. It's the information that makes us humans instead of frogs. It's the information that says you're going to have brown hair instead of blonde hair, or dark skin instead of light skin, or whatever else. And when our cells need to give a message to the rest of the cell, or our DNA, our nucleus wants to give a message to the rest of the cell, what it does is it opens up a book, the bit of DNA, and says, right, this is the instructions that we want you to carry out. And then a bit of messenger RNA, which is the mRNA, looks at that book and writes it down, and off it goes out into the cytoplasm as a message, and gives those instructions to the various proteins and enzymes and everything else that put the building blocks together to follow the instructions. And that's how we live. It's going on all the time. DNA makes messenger RNA goes out into the cytoplasm, makes the things it's told to make. With the vaccine, what we've done, the amazing thing about this vaccine is that we've taken the mRNA that codes for the spike protein on the COVID virus, and we've said, right, if we put that into the cytoplasm, the outside of the cell, it'll give instructions to make the spike protein. And then what our bodies always do is they put that protein onto the outside of the cell, and then our immune system's kind of passing by, just doing its general kind of walk around, making sure everything's okay. And it's got, hang on a minute, haven't seen that before. And it mounts an immune response. And so it says that spike protein, if we see that again, we want to do something about it. And it sends the immune system into action, into making what we call antibodies and getting itself together to fight it off. But what's fabulous about the vaccine is, instead of, if we get the virus does the same thing. But what it does is it doesn't just make spike protein, it makes whole virus. And it makes millions of them. So it hijacks our cells into making hundreds and hundreds of copies of itself. And then they all burst out of the cell, our immune system goes, oh, look at all those proteins, we better mount a response. But by this time, the virus is everywhere. It's hitting every cell all the way through our bodies and hijacking them all into making us into little viral replicating factories. So by taking the spike protein from the COVID virus, making its, working out its message, its mRNA, putting it in our cells, just making the spike protein and getting our immune system to do it that way. We've just bypassed all of that nastiness of having the whole virus in there replicating away. But we've got to where we need to get to, which is making an immune response. It's really, truly amazing and really simple and lovely. The mRNA, once it's done its bit, it just gets taken apart and doesn't exist anymore. It just goes back to its previous components and goes back into action to be another bit of RNA for a different message for something else at another time. And and it's all gone within a few hours to a few days. And when you get symptoms from the vaccine in the few days afterwards, I mean, some people can actually feel a bit rubbish for even a couple of weeks. It's because of your immune system doing something. It's not because the mRNA is still there or even the spike protein is still there. It's your immune system getting all the guns out and getting ready to be on guard the next time it sees the thing. The problem with our immune system is that if it doesn't see it again for a while, it goes off to sleep again. And so the reason we have a second dose and then a booster dose is to wake it up and to say, come on, guys, this is still a problem. And actually, that's also the reason why it's probably going to be useful to have another booster dose later on. They're talking about, hopefully they'll bring out variant specific booster doses that will give us more long-lasting protection and better protection for each variant. But it's such a new thing to roll out a type of vaccine all over the world at once for a disease that we're fighting off everywhere, that we're still working on it. But if we get it, it'll be great.
Sounds very interesting. I don't know if I could do a job in 12 weeks, work out a vaccine for anyway.
It's amazing that
Those people are
fabulous.
Yeah, they're amazing.
Everyone's worked together to do this. Really good.
So, do I need to get vaccinated if I've had COVID-19? For example, if I catch Omicron soon, is this as good as having had the vaccine?
No, that's the problem. So one of the things that is really, really fabulous about our big brains is we have been able as a species to come up with things like vaccination and ways of protecting ourselves from these diseases. And that's actually changed. It's changed our world. We used to die of these diseases all the time. And since we invented vaccination as a way to do this, the game has changed completely. And now we don't actually come across dangerous infectious diseases, especially in countries like New Zealand, where we have access to vaccines on a regular basis. So we're used to only seeing diseases that don't really give us too much of a big deal. That's not entirely true. Working in my field, we do still see all the other diseases, but they are more rare. So they're not stuff people are seeing on a daily basis like we used to see polio and measles and mumps and rubella and all the other things that we can vaccinate for. So in answer to your question, the problem with catching the virus to give you immunity is the virus, interestingly, isn't as good at stimulating our immune system as just using the spike protein. And there's lots of complicated reasons for that I won't go into, but it's also because the virus actually tries to evade the immune system so that it can make more virus before it gets killed off. So it's got things in it that are trying to make you not make a decent immune response, as well as things that might mount a decent immune response. What we've found is patients who are so sick they need to go to hospital or go to ICU, they do seem to mount a good enough immune response that means they have lasting immunity, or at least for kind of the length of time the vaccine's giving us, a number of months. But people have just had mild disease, so even if you've been really sick at home, if you've only needed to stay at home, the immunity is only going to last you about 4 weeks. It's fairly rubbish. So similar to just getting your first dose of vaccine. If you've had your first or second dose of vaccine and you catch it, you might get a bit more. It might act like a booster, but at the moment we don't have any decent evidence for that. The booster is still a better bet for reducing the severity of the disease than catching natural COVID, just because it isn't, it's not as well designed, I suppose. the vaccine's been really well designed and the virus is more haphazard. So you get a haphazard immune response. So personally, I'd rather take the safe vaccine than chance my luck on the virus, because I don't want to get such severe disease that it means I've had, got a good immune response. And if I only have mild disease, then it was fairly pointless anyway, and I'll still need a vaccine unless I want to get it again. And if I get it again, I might get more really severe disease. So I'd rather not take my chances when there's a much safer, better option out there.
Okay. So just got a question around that. So if my child catches COVID with just one vaccination, would they be okay in general? Would one vaccine be better than none? The second one isn't until late March.
Yeah. So for a child, so like I've been saying, children's immune systems are really, really good. So one vaccine is definitely better than nothing by miles. It's not as good as two, but it does actually more of the work than it does in adults. So it's done a pretty good job, especially for those first few weeks. And the reason we have recommended that in children, we space the dose right out to 8 weeks, the second dose, is because of the way their immune systems work. And they seem to get a better response to the second dose if it's further apart than they do to when it's really close together. So at the moment, we're recommending, if your kid's otherwise well and healthy, go with your second dose at 8 weeks, because that will give them the best immune response and they'll be safe enough during that time from their first dose. If you've got a kid that's got other health problems, or like I said, is living in a situation where them passing COVID on to other relatives or things like that might be a really serious problem, then talk to your GP about potentially having it a bit earlier, no earlier than 3 weeks, but you could have the vaccine between 3 and 8 weeks under certain circumstances for children. We just don't think as a general rollout to the population, 8 weeks is best for most people.
Right.
So yeah,
okay.
Go with it that way.
Another one about if you're vaccinated, can you still get long COVID if you're vaccinated?
Ooh, that's a good question. Long COVID. So I might just do a little bit on long COVID first, because a lot of people might not know what it is, and also it gets mixed up with other things. So this, to tell you the truth, is probably my biggest fear around COVID. I'm young-ish, relatively healthy. If I get COVID, I'll probably be fine from a going to hospital type perspective. But the reality is, in the UK, before we had the vaccine, and in America before we had the vaccine, where there was lots of COVID, 40% of people after a mild COVID illness still had symptoms 3 months later. That's a lot of people, and for quite a long time. And I don't have any delusions of grandeur that make me think that I'm somehow different to the average other person. I could be that person who's still got fatigue, who's still short of breath on minimal, just walking around, who's still got neurological problems 3 months, 6 months later. If you end up in hospital with COVID and you're unvaccinated, then you've got 70% of them still have problems a year later. So you don't just have COVID, get sick, go home, and are fine again. This is a serious illness in terms of how sick people are long term. However, we've also been seeing this thing called long COVID, which is that's not just still having symptoms of COVID, it's more like having chronic fatigue syndrome, or ME, as some people might know it. And it's symptoms of severe post-exertional malaise, where you are exhausted if you've done any exertion and used up any energy, be it mental or physical, where you've got brain fog and you can't concentrate and you can't do your work normally. Some people are so exhausted they can't even get out of bed. They also often have muscle aches, mild fevers, and lots of other physical and psychological symptoms that make up this syndrome of long COVID. We don't know really what causes it, apart from that it does seem to be obviously post-viral. We don't really know what causes chronic fatigue syndrome either. The good news is most people with long COVID do get better, although it's taking 3 to 12 months. But a decent proportion either don't or haven't yet gotten better. And it's a really debilitating disease to live with. So about 10% of people who are unvaccinated seem to be getting long COVID. Whether that's just for 3 months or for longer term, we don't yet know. But the numbers who will have it long term will be significantly less than that. If you're vaccinated, the numbers seem to drop down to around 5% or maybe less. So it will halve your risk of getting long COVID, and it might improve it even more than that. So that's really good. Certainly much more than we could hope for from a vaccine. But there is still a lot of unknowns about long COVID. I'm personally hoping that with having all these extra people who've come out with these sorts of symptoms because of in a short period of time because of a single virus, that means there'll be a lot more research goes into what causes it and also how we can treat and cure it, because it's an area that's been under-resourced and under-investigated for many, many years and leaves people, feeling pretty rubbish. So anything you can do to prevent it is good. There is a very small number of people who get long COVID type symptoms after the vaccine, but I will say most of them, pretty much all of them, are getting better within 2 weeks to 12 weeks. And there's certainly no increase in the number of people who get long COVID from the vaccine to the background rate of people who get chronic fatigue syndrome at any point in time. So while it might be vaccine induced, it might have just been chance that this is when you were going to get those symptoms anyway, because as I just discussed, there's still lots of other colds floating around, even if they're coming out as mild. So it's a little bit complicated. We don't have a lot of data yet on teenagers and children with long COVID. It's not as high, it's not as many, but there may be, we think probably a few more people are getting it than would normally get chronic fatigue. And again, vaccination does reduce it. And interestingly, even though Omicron is a less severe disease than Delta was, the doctors in America and Britain that have seen Omicron, for 3 months now, are saying they seem to be seeing just as much long COVID in the unvaccinated as they were in the other variants. So the severity of your disease does not predict whether you'll get long COVID, and even just a mild sniffle, you could still get long COVID. So to me, that's one of the main reasons for being vaccinated, for my personal health, because that's actually my main risk factor, is I want to reduce the chances of having symptoms and potentially something like long COVID long term. Okay.
Just coming out of that, are people with chronic fatigue more likely to get long COVID?
Interestingly, kind of yes. So kind of yes. That's not really an answer, is it? Kind of yes. So what we know is that we've done some really good certainly survey type research on people with chronic fatigue syndrome. There's a website in the US that's been collecting data, self-identified data from people with all types of chronic fatigue syndrome, from severely ill, like bedbound, through to, still fairly well functioning in life. And what they're finding is they are feeling really dreadful, and their symptoms are much, much worse after COVID infection. So yes, it does really, it's really bad for people who've already got chronic fatigue syndrome. With the vaccine, interestingly, 70% of people who get the vaccine who've got chronic fatigue syndrome may get a relapse in symptoms, but are recovered within a few weeks, usually 2 to 4 weeks. And of the 30% who have quite a severe relapse, even a decent proportion of them are recovering over a few months. So it is a worry if you've got chronic fatigue, should you get the vaccine. It's very scary to think that you might have a relapse, but it is much, much better than getting COVID. Right. So if you don't get vaccinated, you're probably looking at having to stay in essentially kind of level 4 isolation while the wave goes through.
Right. So what if I'm self-isolating but feeling fine? Am I allowed to take my dog out for a walk but stay away from people? Is that,
yes, you are. So as long as you don't have COVID, in which case you have to stay home. If you're just self-isolating because you're a close contact, then you're allowed to exercise in your neighborhood on your own. So you could probably isolate, you could exercise with other people you're self-isolating with, so your family members. But yeah, you can take your dog out for a walk. If you're likely to go somewhere where you might be passing other people, then take a mask with you to wear. You know, don't go to the swimming pool or the really packed, I mean, you wouldn't take your dog to the swimming pool anyway, but I'm saying don't go to swimming pools and gyms to exercise. If you're going to take your dog for a walk, don't take him to the dog park where there's loads of other people, you know, like the far end of Island Bay Beach or something like that. Go, you know, take them for a walk where you're not going to be bumping into a lot of others. But yes, you can go out and exercise in your neighborhood.
Oh, that's great. If I get Omicron and I live in a small 3-bedroom house with 1 bathroom, do my partner and kids also have to self-isolate with me? And because there's no real way I can avoid them, we're in a small house. Yeah, are they deemed to have Omicron as well because we live in such close quarters?
So they're not deemed to have COVID as well, no, but they do have to self-isolate. They have to isolate with you. So the whole family goes into isolation, but only the person with COVID is the one who at that point has COVID. So there's a really good information on the COVID-19 website called How to Self-Isolate, and I'm sure we could put the link to that in the Facebook page after this talk. But it really goes through it nicely about what you need to do and when. It's got stuff about exercising and this sort of thing. As I said earlier on, you're not guaranteed to get COVID if you live with other people who've got COVID. So it can be worth trying to isolate a little bit at home and protect those around you. So, you know, wear a mask when you're in shared areas, keep really, you know, wipe down surfaces, keep keep your hands clean. If you're using the bathroom, use it after everybody else is done. If you're making meals, so your family could make meals and plate yours up and give it to you, you know, separately. Or if you're going to use the kitchen independently, use it after the others have come through and used it. But the reality is, if you're in a small house with small children, you're not going to keep small children away from you. And I think that, you know, most parents would think that that was pretty cruel. So, you know, just go for it. And, you know, and if they need their hugs and they need their care and attention, you know, do what you need to do. If they're older children, they probably don't want hugs from you anyway, and will be more than happy to stay well away. They might even just head to their room for 10 days with their iPad if you're not careful. So, I mean, if you can rearrange the house so that you can have your own room during that time, that would be great. But you know, we do appreciate that can be difficult for some families. So it's kind of doing the best you can, and just trying to not spread the infection to your family members means that they'll be able to come out of isolation when you do at day 10 if they haven't caught it. So that's really good, because if they catch it, then they start again at 0. Once you've recovered from it, you will have immunity for the next few weeks. So you can come out of isolation after your day 10, but the other household members who've now caught it have to stay in. There is stuff on the website about how long that all takes, so it's a little bit complicated, but it is okay. But yeah, open windows, do all the stuff that we've kind of talked about anyway about trying not to spread it. And if you don't, then that's great. And if you do, you know, c'est la vie, and just go for it. Your family members will be told when to take a test, so they have to take a test. I think it's day 3 and day 8 anyway, to make sure. But obviously, if they get symptoms, then it's highly likely that they've caught it from you. I would say it would be worth, as a family, making a bit of a plan for how you're going to look after each other. So in terms of that, you're not going to be just shut in a room and left to your own devices for 10 days. You know, make sure that they know you need to be offered paracetamol and throat lozenges and ice blocks and things like that, and checked in on, and how are you doing and how are you feeling, and do you need some water? Make sure you're kept well hydrated. So you're getting a bit of TLC, and checking in as well that you aren't feeling too short of breath or too fatigued, because those would be symptoms that you'd want to check into with your GP around. When you do isolate, when you do get your first COVID notification of being positive, that's day 0. So that's the day you count as day 0, and then you count up to 10. There are a couple of differences to that, but they'll tell you about that if when you test positive. And make sure you've got someone set up to shop for you, because either family or friends, because suddenly none of you will be able to go to the supermarket. So I'd advise getting onto online shopping in advance if you haven't already, so that you're already registered and able to do that. Or make sure you've got someone who's your go-to person to call to send out to the shops with a list and come back. Because it's surprising how you can be thinking, oh, it doesn't matter, we don't have very many vegetables in the house, the market's tomorrow, and then suddenly you go down with a sore throat and can't go anywhere.
So planning ahead is important.
That's right, planning ahead. And there's some good resources out there about how to plan ahead and what you need.
All right, so here's given Omicron is in Wellington now and we're in the red setting, but phase 2, this person is still a bit unclear about whether they should be going out as normal. Should they go out, should they dine out, go to cafes, meet friends for lunch, or should they be hunkering down and avoiding contact a bit? They feel a bit bad for the local businesses, but then they don't want to spread the virus around. Yeah,
so this is, I think we need to, the rules, the phase 2 type rules have been set up for good reason and with a lot of thinking behind them. And as I said, although we are worried about COVID and we'd like, ideally for us to not have this massive peak that overwhelms our hospitals, and potentially it would be quite good if you are going to get it later, because if we, in another 6 months or a year's time, we may have another booster dose, we may have better antivirals, it might have mutated into an even less dangerous disease, so there's good reasons for not getting it. But on the other hand, if you wear a mask and you stick to your own kind of, it's a wide, I was going to say stick to your own bubble, but it's a wider bubble than we've used before in the alert system. It's kind of the people and hang out with regularly, rather than going off to parties with 25 to 50 people and chatting with them, and you wouldn't normally come across them in life. But going to your local cafe, eating with your friends, doing that sort of thing, I think is still pretty safe and is really good for just keeping life ticking over, because we're likely to be doing this, living with Omicron now for a number of months, and totally hunkering down is going to be really tough on everyone. And that's why we're not in level 4 like we did when we were trying to eliminate it. And you are probably not going to get it if you do those things. You still might, and that's life, but you've done all the right things.
Cool. Okay, we're getting close to the end of our time, but here's a question from Dunedin. I'm meant to be traveling up to Wellington in 2 weeks' time to visit family. It was planned several weeks before Omicron. They're a bit worried. Do you think people should be traveling around the country? And what advice do you have if they do travel?
Yeah, I think this is definitely where people's risk aversion lies. So the reality is we've seen that planes and intercity buses and things like that are, if you are on one of those with someone who turns out positive for COVID, then you might end up being in close contact if you were sat in the rows near them. And obviously those people, your risk has then gone up for whether you're going to get COVID or not. So the reality is traveling by plane is now more risky. On the other hand, we also know that if you wear a mask, certainly a surgical mask like they provide for you on the Air New Zealand, or an N95 mask, don't rub your eyes, keep your hands clean, don't cough and spit over the people next to you, and vice versa, and definitely don't travel if you've just developed symptoms of any sort. You'll probably be okay, in fact. And traveling is really difficult because some people need to travel. There's all sorts of reasons why people do need to travel around the country. And in fact, really missing your family or needing to see them for whatever reason is as good an excuse as many other people's excuses. So I think, if there are ways of not traveling, if it's a business meeting or, you're heading off to a wild party or something like that, maybe postpone those ones. But if you've got a really good reason to go, you might never, maybe you've got a sick relative that, you might not see again or something like that, then go for it. And the other thing about aeroplanes is, although we are saying you're probably close contact if you're in the rows near someone, you are traveling with either people who've had a negative rat test in the last 24 hours or they're fully vaccinated. So your risk is, probably less than some of the other places you might go to. Right. So yeah, it's a personal decision. There's no right answer here, but yeah, probably put off non-essential travel, but essential has a wide range of reasons.
Yeah. Okay, so here's our last question for tonight. Can you tell us, actually it's going to be a double header. Do you know when the breakout will peak in Wellington? And then can you tell us when we will go back to normal
Oh my goodness. Whoa, that's two scary questions. Right, we don't know the answer to either of those questions, but so the breakout of Omicron in Wellington will peak a few weeks after the spread becomes uncontrollable in the community. And the problem is that could happen anytime. It could have happened 3 or 4 weeks ago. It could have happened back in November and December. And it didn't. And some of that's probably because as New Zealanders in general, we don't live on top of each other. We're not living in a lot of high-rise apartments. And although many of us do live in multi-generational families, you know, we've generally got a bit more space around us than people in other countries do, and other large cities do as well. And so that's probably protecting us. As I also said earlier, our vaccination rates in Wellington are, you know, superb and something we can be very proud of. And we also, you know, if you walk down the streets of Wellington, in most places anyway, people are really good about wearing masks and just stepping aside if you think you've got too close. And so we're doing all the right public health measures. So it might be that actually we flatten the curve here in Wellington really well. And yes, we've got to keep persisting with doing these measures for longer, but that means that our hospitals don't get overwhelmed with patients, and more importantly, that not as many patients get as sick and you know, potentially have to live with symptoms for a long time or forever. In terms of when we might get back to normal, that also kind of depends. We may well have a difficult winter ahead, because once we open the borders, it's likely we'll get infections of flu and RSV back in as well, because they've got a really short incubation period, and they've pretty much been kept out by having MIQ. So once we stop having MIQ and people come out, if anybody goes out and about with, you know, when they shouldn't, with those symptoms, it's going to start spreading in our communities. So winter could well be really hard, and we're going to have to make a big effort to look after each other. The flu vaccine is coming for this year. It's going to be out towards the end of March, beginning of April. Hopefully not everyone is eligible for the flu vaccine for a lot of complicated reasons, but if you are, please make sure you get it. And if you aren't, consider getting it anyway. If you can afford to buy one from a pharmacy, or your workplace offers a free flu vax, go ahead and get it regardless, because that'll be really good for preventing a big wave of those infections through winter. And I personally am fairly hopeful that if we don't get another variant that's nastier than Omicron, we might be either through this or into the stage where it's mutated into something more mild come the end of this year, beginning of next year. Many pandemics in the past where we haven't had the same abilities to control things as we do these days, they generally say 2 winters. And the Northern Hemisphere is coming out of that second winter now. And we benefit from their second winter, you know, in terms of we don't necessarily need 2 of our winters to go through it. So it could be that towards the end of our first winter, things are settling down. But like all forecasts, you know, none of us thought 2 years ago we'd be in this position at all. So that's my personal hope, possibly over-optimistic hope, that by next summer, things will be much better. But please don't hold me to it.
No, that's right. We will not come back to you.
That's right.
We'll just all do our bit and try and get vaccinated and wear masks and all that sort of stuff.
Yeah, and if we get another booster, take it up. Go and get your booster, get your flu jab, and have your fourth dose if it becomes available at some point later in the year as well.
Awesome. So sadly I have to wrap this up. There've been more questions, but we've literally run out of time. Just wanted to thank our sponsors again: Island Bay Enhancement Trust, Unichem Island Bay New World, Wellington City Council, Island Bay Community Centre in Aotearoa. I'd also like to thank you, Marion, for joining us tonight and sharing your knowledge. You were very easy to understand, even though you were talking about stuff that is complex in nature. And to everyone out there, this session will be loaded to Facebook, and you'll be able to share it with your whānau and friends, along with the other 2 sessions which are already out. I'll end with a karakia, kia tau, kia tātou katoa, Te ao, te aroha, me te marutau, tihei Māori ora. May peace, love and safety be upon us all. Tihei Māori ora.
Thank you, Ty.
Thank you.